conference in the United States Congress, and we hope to be able to give clear directions on the proper use of opioids. But then there's the issue of how do you deal with people who have addiction problems. The example I like to give is someone shows up in the emergency room, usually in the middle of the night, that's when they usually show up, and they're high on heroin or opioids, and the hospital does what it's trained to do. They get the person out of danger, and then what do they do with the person? What can they do with the person? If the person's not going to enter our criminal justice system, the person's going to be released, advised as to how they can get treatment, but there's virtually no follow-up. Or someone shows up in the primary care setting, and the people that are there are not trained to deal with addiction. They're not trained to deal with mental health issues. What do they do as far as follow-up care is concerned? We don't have enough services available in our community today to deal with addiction. But if you're going to be successful, you've got to reach the person at time of need. And if you don't have those resources in the emergency room and the primary care offices, how do you provide that type of service? So one of the things we're looking at is either a collaborative or integrated care model where you actually have those services provided, reimbursed by the healthcare system. Today, the healthcare system will reimburse the emergency rooms or primary care facilities. We have a couple demonstration programs, but we don't have a more comprehensive way to make sure that the community-based services are available when they're needed to get people the treatment that they so desperately need. So that's some of the things we're looking at as to how we can provide a more comprehensive care model for these services. And we're looking at, the interesting thing is, every demonstration we've done on a collaborative care model has saved money. Every single one. So this isn't even the fact of adding to the cost of healthcare. You actually reduce the cost of healthcare if you can get the people the care they need. And the congressman just came in here.
Hello, Senator.
I thought I recognized him. It's good to have Dutch with us. I had mentioned you earlier that we work together as a team. This is an issue that...
not only in the state of Maryland, we know we were in Baltimore City trying to deal, and now in Harford County and all the counties of the state of Maryland. I think the first thing it's important to know that addiction is clearly a disease of the brain, and we have to identify that it is a disease of the brain. I know that when I first came into Congress, we had serious drug problems, especially in this corridor right now, and we came together. We focused on what we needed to do, and it just didn't take law enforcement. It took the whole community coming together, and that's part of what we have to do. But I want to give an example about, we hear about inner city issues and those type of things. There are many, many athletes right now who are in whether rec council or in high school playing sports, and they blow out a knee, and then they have the knee operation. Then they start taking Oxycontin or something to that effect, and then the next thing you know, they get to another level, and their parents don't even know it most of the time, and then it moves to another level, and that happens over and over and over again. So we have to identify all the different problems, whether it's inner city, whether it's in certain areas of our county, it's everywhere, and we have to identify that. And I see Boys and Girls Club, that's an example of the type of situation to reach out and understanding and relating to the younger generation and what's happening. So, I want to listen right now because Ben and I are your representatives. We want to do whatever.
This is democracy, so speak out about the need for these types of resources. But secondly, I think the story of the sheriff's office here is not widely understood, that they look at those who are addicted as victims and are reaching out to help. This is not an adversarial situation. So I think that message needs to be out there. We know there's a general mistrust. We see this in the election cycle, the mistrust of the voters. So there's a mistrust out there. We've got to establish a better degree of confidence that we are trying to reach out, that we know that our community has, as Dutch said, an illness. And we've got to address it as a community public health problem. And that's how and that means law enforcement's working as a public health crisis, as well as the educators, the leaders in our educational system, all trying to come together. We're not trying to penalize people, we're trying to help people. So I think that's one message. Secondly, this is a problem that knows no bounds, and therefore it needs to be dealt with. It doesn't take, we're not talking about huge dollars, we really are not. We're talking about a smart investment, focusing our dollars where they need to be. So we're not asking for a type of an appropriation that would require new taxes. That's not what's involved here. It's allocating the resources in a smarter way that allows for law enforcement to have resources so they can do timely investigations. It allows the health department and the private sectors to have enough funds that they can meet timely needs for people who are reaching out to get services. It requires that there's no shortage of narcotic drugs so that we can save lives. That's what it involves. So I think we have a sensible plan, and no one expects that we're going to solve this problem overnight. But we certainly can make a lot more progress than we've made. I think that's the message we would like to see you reinforce and get us all in the same